The Mumbai civic body has added 16 ICU beds, 227 ventilators and over 1,500 oxygen beds to the city for the treatment of coronavirus patients. Remember, Mumbai's health infrastructure has been under tremendous pressure as the city records over 60,000 COVID cases. Let me bring in my colleague Disha tracking this input for us. So Disha, you've given us the figures really of ventilators, oxygen beds and ICU beds. If you can take us through the breakdown of the figures first and tell us how important this is, because ultimately the real crisis is going to be in critical care. It's very easy to create isolation beds even at home or recreation centers in some cases in societies, but beds which have oxygen supply, which have a ventilator backing, that is a crucial element. Tell us about the latest decisions taken.
Well, certainly, Afrida, why this is important here, significant, is because the city here of Mumbai has already crossed over 61,000 positive cases. It has over and about 26,000 active cases. So you can look at how there is a need of beds across, be it in BMC run hospitals, be in private hospitals, and even COVID care centers. So keeping in mind in the month of June that how we have witnessed a surge, we have witnessed an increase in the number of cases, because on an average, we are looking at over and about 1,300 positive cases being reported every day. So if we talk particularly about figures, Afrida, as far as ventilators are concerned, in the month of June, the civic body has added 227 ventilators across the BMC private and COVID care centers, taking its total capacity to 757. And out of which 741 ventilator beds are already occupied and only about 16 ventilator beds are available in the city of Mumbai. So that's the biggest concern here. Secondly, as far as the ICU beds are concerned, the BMC has increased the capacity to 1,197, out of which only 38 ICU beds are available in the city of Mumbai. That's again the crucial part. And in the month of June, BMC has added 16 ICU beds. Lastly, talking about the oxygen beds, because not a lot of patients would require ICU and ventilator. It's only the critical, of course, patients. But as far as the oxygen beds are concerned, the capacity has been increased to 6,951, out of which 1,300 beds are available, oxygen beds. And these are across the BMC hospitals, private hospitals, as well as the COVID care centers. So these are the situations that we are looking at. And going forward, BMC says that they will...
Yes. Okay, the numbers are still rising. Is yet to be reached. Even if a small percentage of the numbers require hospitalization and critical care, beds can fall short of the requirement. That's the concern being addressed. Thanks for joining us, Tisha.
Mirror Now.